I found the blood on my wife's clothes the same night I discovered she'd been poisoning our daughter for attention. The stains were small, tucked under the collar of the scrub top she'd thrown in the laundry basket, but after 15 years as a paramedic, I know what fresh blood looks like. And I know what it means when a registered nurse has unexplained blood on her uniform after a 12-hour shift in pediatric oncology. My name is David, and this is the story of how I learned that the woman I'd loved for 18 years had been slowly killing our 8-year-old daughter Emma to feed her need for sympathy and attention. And how I made sure she could never hurt another child again. Some people will say I went too far, that I should have just called the police and let the system handle it. But when you discover your wife has been injecting your daughter with contaminated blood to make her sick, when you realize that every hospital visit and every terrified night was orchestrated by the person you trusted most in the world, the system starts to feel inadequate. Before I tell you what I did next, I need you to understand something about betrayal. It's not just about the lies or the manipulation. It's about realizing that every moment of your life that you thought was real was a performance. Every tear, every worried phone call, every sleepless night spent holding your sick child while your wife played the role of devoted mother, all of it was theater. If you've ever had someone you trusted completely turn out to be a stranger, hit that like button. If you believe some betrayals are so deep they change you or forever, subscribe. Because this story doesn't have a happy ending, it has a necessary one. And you'll want to see how far a father will go to protect his child from the person who's supposed to love her most. I should have known something was wrong 6 months earlier when Emma started getting sick again. She'd been healthy for almost a year after her last round of chemotherapy, and Dr. Martinez had been optimistic about her remission. Then suddenly she was back in the hospital with infections that didn't respond to treatment, blood work that showed signs of immune system failure, and symptoms that didn't match any pattern the oncology team had seen before. Sarah, my wife, was Emma's primary caregiver during the day while I worked my shifts with the ambulance service. She'd been a pediatric nurse for 12 years before Emma was born, and when our daughter was first diagnosed with leukemia at age 6, Sarah had taken a leave of absence to focus on Emma's care full-time. The doctors praised her dedication. The other parents in the oncology ward looked up to her as an example of maternal devotion. I was proud of my wife. Even when I was exhausted from pulling double shifts to cover our medical bills, even when I came home to find Sarah crying over Emma's latest test results, I never questioned her commitment to our daughter's health. Sarah knew more about pediatric medicine than most doctors. She tracked every symptom, recorded every medication, and advocated fiercely for Emma's treatment. If our daughter were getting sicker despite the best medical care available, it had to be the cancer coming back. But the blood on Sarah's scrubs told a different story. I found it when I was loading the washing machine before my next shift. Sarah was at the hospital with Emma, who'd been admitted again the day before with another infection. I was grabbing clothes from the laundry basket when I noticed the stains, 3 small spots on the collar of Sarah's work uniform, dark red against the pale blue fabric. Fresh blood doesn't usually end up on a nurse's collar unless something has gone very wrong. In pediatric oncology, nurses are careful about contamination. They wear protective equipment. They follow strict protocols. Blood on the collar suggests either a major accident or intentional contact. I held the scrub top up to the light and looked closer. The stains were consistent with splatter from a syringe or injection. Small droplets that had hit the fabric at an angle and dried there. The pattern was familiar from my own work. It's what happens when you're drawing blood or giving an injection and something goes wrong with the needle. I called Sarah's hospital and asked to speak with her supervisor. I explained that I was Sarah's husband and that I'd found what looked like blood on her uniform. I asked if there had been any incidents during her shift that might explain it. The supervisor's voice carried confusion and concern. "Mr. Thompson, Sarah wasn't scheduled to work yesterday. She called in to request family leave because Emma was being admitted." My blood went cold. She wasn't at work? The supervisor's tone became more serious. "No, she's been on family leave for the past 3 weeks while Emma's been in and out of the hospital. We've been very supportive of her need to focus on Emma's care." I hung up and stared at the scrub top in my hands. If Sarah hadn't been at work, where would the blood come from? And why was she wearing her nursing uniform when she was supposed to be at the hospital as Emma's mother, not as a staff member? I drove to the hospital and went straight to Emma's room. Through the window, I could see Sarah sitting next to Emma's bed, holding our daughter's hand and talking quietly to her. She was wearing regular clothes, jeans and a sweater, not the bloody scrubs I'd found at home. I watched them for several minutes before going in. Emma looked pale and tired, connected to an 4-drip and monitors that tracked her heart rate and oxygen levels. Sarah looked worried and exhausted, exactly like a mother whose child was fighting for her life. I kissed Emma's forehead, my voice gentle despite my racing thoughts. "Hey, baby girl. How are you feeling?" Emma's voice was weak but trusting. "Tired, Daddy. But Mommy says the doctors are going to make me better." I looked at Sarah, trying to keep my suspicion from showing. "What are the doctors saying?" Sarah's voice was steady and professional as she recited Emma's condition. "They're still running tests. Emma's white cell count is low again, and they're concerned about another infection. Dr. Martinez wants to keep her for observation." Sarah's voice was steady and professional. She recited Emma's symptoms and treatment plan with the precision of someone who understood medical terminology. Nothing in her manner suggested deception or guilt. She looked exactly like what she was supposed to be, a devoted mother and experienced nurse using her skills to help her sick daughter. But I couldn't stop thinking about the blood. "Sarah, I found something at home that I wanted to ask you about." She looked up from Emma's chart with mild curiosity. "What kind of something?" "Blood on your scrubs." "Fresh blood." For just a moment, something flickered across Sarah's face. Fear, maybe? Or calculation. Then she smiled and shook her head with practiced ease. "Oh, that. One of the other mothers had a nosebleed in the family lounge yesterday. I helped her clean up. I must have gotten some on my uniform." It was a reasonable explanation. The kind of thing that happens all the time in hospitals. But something about the way she said it bothered me. Too quick, too detailed, too perfectly plausible. "Which mother?" Sarah's response came without hesitation. "I don't remember her name. Her son is in room 314. Poor kid, maybe 10 years old, has been here for weeks." Room 314 was empty. It had been empty for months, ever since the hospital had converted that wing to outpatient services. I knew because I'd been in this hospital dozens of times over the past 2 years. I knew the layout, the room numbers, and the staff rotations. Sarah was lying. I didn't confront her then. Emma was listening, and I didn't want to upset her. Instead, I stayed with them for an hour, talking about school and friends and the books we'd read together. Normal father-daughter conversation, except nothing felt normal anymore. After Emma fell asleep, I walked Sarah to the parking garage. My voice was quiet but firm. "Room 314 has been empty for 6 months." Sarah stopped walking. For a long moment, she didn't say anything. Then she turned to face me. Her voice carried a note of uncertainty now. "I made a mistake about the room number. It was 324. There is no room 324 on that floor." Sarah's defensive posture was immediate. "David, what are you trying to say?" "I'm trying to understand where the blood on your clothes came from." Sarah leaned against her car and crossed her arms. In the fluorescent light of the parking garage, she looked older than her 39 years. Tired and defensive, and something else I couldn't identify. Her voice turned cold and accusatory. "Are you accusing me of something?" "I'm asking you to tell me the truth." Sarah's words came out in a rush of practiced victimhood. "The truth is that our daughter is sick, and I've been taking care of her while you've been working double shifts and questioning my every move. The truth is that I'm doing everything I can to help Emma get better while you're worried about blood stains on laundry." She was right about the double shifts. With Emma's medical bills and Sarah not working, I'd been taking every overtime opportunity available. I'd been absent more than I wanted to be, leaving Sarah to handle most of Emma's care alone. But that didn't explain the blood. "Sarah, I called your hospital. You haven't been working for 3 weeks." Her face went very still. Her voice was carefully controlled. "What?" "Your supervisor said you've been on family leave. So why were you wearing scrubs yesterday? And why is there blood on them?" Sarah stared at me for a long time. Then she got in her car and rolled down the window. Her voice carried a threat disguised as concern. "I think you need to decide whether you trust me or not, David. Because this marriage can't survive if you're going to investigate me every time something doesn't make perfect sense." She drove away, leaving me standing in the parking garage with more questions than answers. That night, I couldn't sleep. I kept thinking about the blood, about the empty room number, about the look on Sarah's face when I'd questioned her story. I'd been a paramedic for 15 years. I'd learned to trust my instincts about when something was wrong. And everything about this situation felt wrong. At 3 in the morning, I got up and drove back to the hospital. I used my EMT credentials to get into the building and went to Emma's room. She was sleeping peacefully, and her overnight nurse told me there had been no changes in her condition. But I wasn't there to check on Emma. I was there to check on Sarah. I found her in the family lounge, wearing scrubs again. She was sitting alone with a medical kit open on the table in front of her, syringes, alcohol swabs, and several vials of what looked like blood samples. She was drawing liquid from one of the vials into a syringe. My voice cut through the silence. "Sarah?" She jumped and knocked over the vial, spilling dark red liquid across the table. Her voice was sharp with surprise and fear. "David, what are you doing here? What are you doing?" She started shoving the medical supplies back into the kit with frantic movements. Emma needed her medication. The night nurse was busy with another patient. "What medication?" Sarah's explanation came too quickly. "Her antibiotic. Dr. Martinez prescribed it this afternoon." I looked at the spilled liquid on the table. It was too dark to be an antibiotic solution. Too thick. It looked like blood. "Sarah, that's not medication." Her voice became defensive, almost angry. "You don't know what you're talking about. I've been giving injections for 15 years. I know what medications look like. That's blood." Sarah closed the medical kit and stood up, her movements sharp and defensive. "I think you should go home, David. You're obviously exhausted and not thinking clearly. Whose blood is it?" Her voice turned cold. "I'm not having this conversation. Whose blood were you about to inject into our daughter?" Sarah's face went white. For a moment, she looked terrified. Then something seemed to click into place and her expression hardened. Her voice carried authority and manipulation. "Get out, David. Get out before I call security. Not until you tell me what's going on." Sarah's voice rose with calculated hysteria. "What's going on is that you're having some kind of breakdown. You're seeing things that aren't there. You're making accusations that don't make sense. And you're scaring me." She was good. Even caught red-handed with blood and syringes, she was making me question what I'd seen. Making me wonder if I was losing my mind. But I wasn't losing my mind. I was finally seeing clearly. "You've been making Emma sick." The words hung in the air between us. Sarah stared at me, and I could see her calculating her next move. Her voice was flat, dismissive. "That's insane. You've been injecting her with contaminated blood to cause infections. That's why her immune system keeps failing. That's why the doctors can't figure out what's wrong with her." Sarah's response was immediate and practiced. "You're having a psychotic break, David. You need help. Show me what's in the kit." Her voice was firm, final. "Absolutely not. If it's just medication, show me." Sarah picked up the medical kit and held it against her chest like a shield. Her voice carried threats disguised as concern. "I'm calling Dr. Martinez. I'm telling him that you're having delusions and making threats. I'm telling him that you're not safe to be around Emma." That's when I knew for certain. If Sarah had been innocent, she would have opened the kit to prove me wrong. She would have called me crazy and shown me the medication labels and made me feel foolish for doubting her. Instead, she was threatening to have me banned from seeing my own daughter. "How long has this been going on?" Sarah's voice took on a pleading quality. "David, please. You're scaring me. How long have you been poisoning Emma?" Sarah backed toward the door, still clutching the medical kit. "I'm getting security. The first time she got sick. When she was 6. That wasn't cancer, was it?" Her voice was sharp now. "Stop it. You made her sick so she'd have to go to the doctor. And when they found abnormal blood work, you let them assume it was leukemia. You let them put our 6-year-old daughter through chemotherapy for a disease she didn't have." Sarah's voice cracked slightly. "You're insane. And when she got better, when the chemo stopped and she started being healthy again, you couldn't stand not being the center of attention anymore. So you started making her sick again." Sarah reached the door and stopped. When she turned back to face me, her expression had changed completely. The fear was gone. The defensiveness was gone. What was left was something cold and calculating that I'd never seen before. Her voice was steady, confident, terrifying. "You can't prove any of this. I don't have to prove it. I just have to protect Emma." Sarah's tone became mocking. "From who?" "From her mother, who's devoted her life to taking care of her. From the woman who's been slowly killing her for attention. Sarah smiled, and it was the most terrifying thing I'd ever seen. Her voice carried the weight of someone who'd planned for this moment. Good luck with that, David. You're a paramedic with a history of depression who's been working too many hours and clearly having a mental breakdown. I'm a registered nurse with 12 years of experience in pediatric care who has been heroically caring for my sick daughter while my husband falls apart. Who do you think people are going to believe? She was right, and we both knew it. Sarah had spent 2 years building a reputation as the perfect mother, the devoted caregiver, the nurse who'd sacrificed her career to save her daughter's life. Everyone at the hospital loved her. Everyone in our community admired her. Everyone who knew our story saw her as a saint. I was just the father who worked too much and wasn't around enough. I'll figure it out, I said. Sarah's voice carried cold certainty. No, you won't. Because if you try to interfere with Emma's medical care, if you try to turn anyone against me, I'll have you committed for psychiatric evaluation. I'll get a restraining order. I'll make sure you never see Emma again. You can't do that. Her confidence was absolute. Watch me. I'm a medical professional reporting concerns about my husband's mental state. Emma's primary care physician will back me up. The hospital staff will back me up. Everyone who's seen how devoted I am to Emma's care will back me up. Sarah opened the door and paused. Her voice was dismissive, authoritative. Go home, David. Get some sleep. When you're thinking more clearly, we can discuss getting you the help you need. She left me standing in the family lounge, surrounded by the smell of spilled blood and the sound of my own heartbeat. Everything she'd said was true. I had no proof of what I'd seen. No witnesses to back up my accusations. No evidence except my own word against hers. But I had something else. I had the absolute certainty that my wife was slowly murdering our daughter, and the knowledge that I was the only person who could stop her. If you're wondering what you would do in my situation, if you're trying to imagine how you'd fight for your child when the system is designed to protect the abuser, this is probably a good time to hit that subscribe button. Because what happened next changed everything, and the decisions I made over the following weeks affected not just my family, but dozens of other families who had no idea they were in danger. So subscribe now, and let me know in the comments what you think a father should do when the law can't protect his child from the person who's supposed to love her most. Over the next 3 days, I watched Sarah carefully. I took time off work and spent as much time at the hospital as possible, observing her interactions with Emma and the medical staff. To everyone else, she looked exactly like what she was supposed to be, a loving mother and skilled nurse working together with the doctors to help her daughter recover. But I was watching for different things now. I was watching for opportunities when Sarah was alone with Emma. I was watching for times when she had access to medical supplies. I was watching for moments when Emma's condition changed unexpectedly. The pattern was subtle but consistent. Emma would be stable for hours, and then suddenly she'd develop new symptoms or her blood work would show signs of infection. These episodes always happened during times when Sarah had been alone with her, and they always resulted in adjustments to Emma's treatment plan that kept her in the hospital longer. On the 4th day, I brought a small digital camera to the hospital. I hid it in the family lounge and left it recording while I went to get coffee. When I came back, I found Sarah in the room, preparing another injection from a vial that wasn't part of Emma's prescribed medication regimen. This time, I had proof. I didn't confront her immediately. Instead, I took the recording to Dr. Martinez and asked him to review Emma's treatment history with me. I showed him the footage of Sarah preparing unauthorized injections, and I asked him to test the contents of the vial I'd managed to retrieve. The blood in the vial was contaminated with bacteria that matched the infections Emma had been fighting. It wasn't Emma's blood. DNA testing later proved it came from multiple sources, probably other patients in the hospital. Dr. Martinez was horrified. The hospital launched an immediate investigation, and Sarah was arrested the same day. The criminal case that followed revealed the full scope of what Sarah had done. She'd been making Emma sick for over 2 years, using contaminated blood samples she'd stolen from the hospital's lab. She'd induced dozens of infections, caused unnecessary chemotherapy treatments, and put Emma through medical procedures that were not only painful but potentially fatal. The investigation also revealed that Emma had never had leukemia. The original diagnosis had been based on blood work that Sarah had manipulated by injecting Emma with contaminated samples before the tests were taken. Our daughter had spent 2 years fighting a disease she didn't have while her mother poisoned her to maintain the fiction. Sarah was convicted of child abuse, attempted murder, and medical fraud. She received a sentence of 25 years in prison. The hospital faced multiple lawsuits and implemented new security protocols to prevent similar cases. Emma survived, but the damage was extensive. The unnecessary chemotherapy had weakened her immune system and affected her growth. The repeated infections had caused organ damage that would require lifelong monitoring. The psychological trauma of believing she was dying while her mother slowly poisoned her would require years of therapy. But she was alive. And she was safe. The hardest part wasn't the criminal trial or the media attention or the dissolution of my marriage. The hardest part was explaining to Emma why Mommy had hurt her. How do you tell an 8-year-old that the person she trusted most in the world had been deliberately making her sick? How do you help a child understand that kind of betrayal? We're still working on that. Emma and I both go to therapy twice a week. We're learning how to trust people again, how to build relationships that aren't based on manipulation or deception. We're learning how to be a family without the person who defined our family for so long. 3 years later, Emma is healthy. She's back in school, she has friends, she plays soccer and takes piano lessons. She still has nightmares sometimes, and she still gets anxious around medical procedures, but she's strong and resilient and brave in ways that constantly amaze me. People ask me if I regret how I handled the situation. They ask if I think there was a better way to protect Emma without destroying Sarah's life. And my answer is always the same. I regret that it took me so long to see what was happening. I regret that I trusted someone who was harming my child. I regret that other families might have gone through similar situations without anyone figuring out the truth. But I don't regret stopping her. I don't regret gathering evidence and presenting it to the authorities. I don't regret making sure Sarah could never hurt another child. Because here's what I learned about betrayal. It's not just about the person who betrays you. It's about all the people they might betray in the future if you don't stop them. Sarah wasn't just poisoning Emma, she was planning to return to work in pediatric nursing once Emma recovered. She would have had access to dozens of vulnerable children whose parents trusted her to help them heal. Sometimes protecting your own family means protecting everyone else's family too. The investigation into Sarah's case led to a review of other suspicious medical cases she'd been involved with over her 12-year career. 3 other children had died from unexplained complications during periods when Sarah was their primary nurse. Their families deserved to know the truth. That's the thing about medical betrayal. It's not just personal. When someone in a position of medical authority abuses that trust, the ripple effects can destroy multiple families. The parents who blame themselves for their child's death, the siblings who grow up thinking they might carry some genetic disease, the medical professionals who question their own competence because they couldn't save a patient who was being deliberately harmed. Sarah's actions affected dozens of people over more than a decade. The family she destroyed wasn't just ours. So if you're dealing with something similar, if you suspect someone in your life is causing harm to get attention or sympathy, if you're seeing patterns that don't make sense medically, if your instincts are telling you something is wrong even when everyone else thinks you're crazy, trust yourself. Gather evidence. Protect the vulnerable people in your life, even if it means going against someone you love. Because love doesn't excuse harm. Trust doesn't excuse abuse. And family doesn't excuse betrayal. That's the hardest lesson I've learned as a father. Sometimes the people who are supposed to protect your children are the ones you need to protect them from. And when that happens, you don't have the luxury of giving them the benefit of the doubt. Emma is 10 now. She doesn't remember much about being sick, which is a blessing. What she remembers is that Daddy figured out how to make her better and made sure no one could hurt her again. That's the story she tells when people ask about her scars or why she doesn't have a mommy. It's not the whole truth, but it's enough truth for now. Someday, when she's older, I'll tell her the rest. I'll explain about Munchausen syndrome by proxy and medical abuse, and how sometimes people who seem caring and devoted are actually predators. I'll help her understand that what happened to her wasn't her fault and wasn't random. It was the result of one person's mental illness and criminal behavior. But for now, she knows that she's safe. She knows that the people in her life now, her therapists, her teachers, her friends' parents, and me, are people who can be trusted. She knows that if someone hurts her or makes her uncomfortable, She can tell me and I'll believe her and protect her. That's the foundation we're building our new life on: truth, trust, and the absolute certainty that Emma's safety comes before everything else, including my own comfort, my own reputation, and my own desire to believe the best about people. Because I learned that being a good father isn't about being understanding or forgiving or giving people second chances. Being a good father is about protecting your child from harm, even when that harm comes from someone you love, even when stopping them destroys your own life in the process. Emma is worth it. Every child is worth it. And if this story helps even one parent recognize the signs of medical abuse, if it helps one family avoid what we went through, then sharing it was worth the pain of reliving it. So hit that like button if this story made you think differently about trust and protection. Subscribe if you want to hear more stories about real families dealing with real betrayals and finding ways to survive them. And let me know in the comments what you would do if you discovered someone you loved was hurting your child. Because unfortunately, our story isn't unique. Medical abuse happens more often than people want to believe. And the only way to stop it is for people to be willing to see it, report it, and put children's safety ahead of family loyalty. Thanks for listening. And remember, if something feels wrong, it probably is. Trust your instincts. Protect your children. And don't let anyone convince you that love excuses harm.